I am Jaroszewski. Dr. J, as most patients and staff call me. I am the chair of thoracic surgery here at Mayo Clinic in Arizona. One of my main specialties is chest wall deformities. I operate on a variety of types, but pectus excavatum is by far the most common and what we are actually internationally famous for here. Pectus is a big passion of mine. It's an area where you change people's lives. It's something not many people know much about, and we've developed the specialty, a niche here where we treat patients that come from everywhere with all types and shapes of deformities. It is extremely rewarding and has been a big part of what I do and has a large part of my heart. My road to doing pectus, it was actually not a straight one. When I finished my training here, I did general surgery at Mayo Clinic. I went then for cardiothoracic at Baylor in Houston. After finishing, the plan was that I was going to be back here on staff, but that funding didn't come through on the job, so I needed to find something to do for a year. And I ended up at UCLA, where there was a famous pectus surgeon that I operated with every week, and he taught me about pectus. And then when I came back a year later to Mayo, we then established a practice here and have now built up probably one of the largest centers in the world that treats adult pectus. So I became a doctor, and people ask me, did you always want to be a doctor? But the truth is, I had a very different pathway. I finished high school at only 3 years. I had no clue what I wanted to do, so I went to work. I worked for a real estate office. I got my license and I did real estate for a number of years. I got my undergraduate and my master's in business administration, so I went from there to running a surgery center. And it was actually at the surgery center that I decided I wanted to be a surgeon. They basically had operating suites at the end of the hallway, and I'd stand there and I'd look, and I'd want so bad. And they actually one day said, well, why don't you come in? Why don't you join us, watch some surgeries and see what you think? And that kind of was a bug that bit me, and went down that road of going to medical school. I didn't start medical school till almost the end of my 20s, finished late, and here I am. So one of the most rewarding aspects of what I do is watching the transformation of a patient after you've fixed their chest. They go from patients that have their whole life been teased and felt like they were inferior because of a deformity. It limits their ability to exercise and to keep up with their peers. And you fix these people and you watch them blossom. They change into runners and competitive. They tell you with like tears in their eyes that now they go to the beach, they go to the pool, they interact with family and friends like they never have been able to before. And it's a very emotional, deep experience to watch this happen. And it's part of why I've become so passionate about pectus. So I think what's important about myself as a surgeon and about Mayo Clinic and why you should come here for your treatment. You have best trained, you have tremendous experience, you have passion, and you have this group that comes together. So when you come here to see me for pectus as a surgeon, you see a cardiologist, you see physical therapy to help you with recovery. We have specialized testing. We do what no other center in the world does, and that's critical to understanding you, to making sure that we're doing the right operation for you, and that your recovery is going to be as quick and as easy as possible.